Hi, I just pulled up to work here to the office and I got word on the way in. One of the patients came in early. Um, he is very excited about his care. He had low back pain, sciatica, and he's made a full recovery. And we're gonna go in and talk to him. I'm gonna see if we can get him to provide a little testimonial here and kind of give you guys an idea how we resolve these issues. All right, come along, follow me. We have a lot of great practices here in this building, and I feel happy or excited that I can be surrounded by these people. We have great dentists, great family practice, other private businesses here, but it's a great building to be a part of. Let's take a look. Hi, welcome to Precise Chiropractic and Rehabilitation. I'm Dr. Hans, and I have a patient here, Brad, who came to see us for low back pain, radiating down his leg. It's pretty severe, but I'll let him tell the story.
Hi, so I had a little back pain from a violent coughing spasm. Was to the point to where I could barely walk, excruciating pain down my right leg. Did two things. I scheduled an appointment to get injections in my back to relieve my pain that I was suffering, and I called Dr. Hans. Unfortunately, the pain clinic wasn't able to see me for about a week and a half to 2 weeks, so I immediately came to Dr. Hans the next day.
So Brad came in, it was obvious that he was in a lot of pain. He was moving very slow, taking a minute or two to get up from his chair, taking several minutes to get onto the table. It was just difficult. He was in a lot of pain, I could tell. And initially I thought we're gonna get him to his pain management appointment so he could just function in that week and a half, but we ended up getting him better and he ended up canceling that appointment. So what we did is we did an exam, discovered what was going on. It was pretty obvious it was low back, but what part of his low back? So we narrowed that down as a L5 disc issue causing radiating pain down his leg all the way to his foot. Occasionally his leg would go weak and want to give out on it. It was also very numb. Had a lot of pain in the hip and in the glutes, numbness in the feet. So our treatment, it's okay if I share what we did?
Absolutely.
So our treatment is we, of course, did some basic stretches, heat to get the back loose. We did light traction on the spine and dry needling. Dry needling, I'll have a separate video on that, but dry needling relieves muscle tension, improves blood flow, manages and reduces pain, and most importantly, reduces the muscle spasms in any scar tissue or connective tissue that has formed over time, helping lead to these kind of injuries. So we dry needled, and then we did light chiropractic adjustments to the low back at first, just to get some movement back in that back. How do you feel after the first few adjustments and first few treatments and dry needling?
The first few adjustments went well. After the third dry needling, that's when the big improvements came. My back started loosening up to where I could actually move up and down. The big thing for me was being able to put my own shoes on and not have to either rely on my significant other or wear flip-flops out. And then going from there, being able to get on the foam roller also helped relieve the pain down my leg as well.
And, you know, it sounds like such a simple thing, the foam roller, but if you can't get on the ground to use it, it's useless. So, you know, as Brad said, we kept him working. He worked from home. He's now working both in the field and at home. He worked from home, continuing to not lose time there to keep producing and providing for his family, participating with his kids, most importantly, being there for his family, interacting with his family. I think that's one of the biggest things that most of my patients want to achieve. And as Brad mentioned, the dry needling, the adjustments, the traction, the heat, the stretches, the rehab, we do it all here. We do chiropractic, we do physical therapy. That started to layer on each other and start to provide cumulative results, which now Brad actually just getting out of his chair, walking around like normal and back to his old self, the Brad we all like and we all laugh when he comes here.
Absolutely.
So, we enjoy having Brad come here. We aren't happy that he got hurt, but we enjoy that he's here to help him get better. What kind of quality of life are you doing now? Like, what do you look forward to doing this weekend? You said you had a home project?
Yeah, look forward to rebuilding a wall where the staircase used to be to add some cabinets for my kids to do a homeschool project. With the current situation we're in, just trying to keep myself active and actually have somewhat of a life now that I can bend over and sit down and do everything without pain.
I mean, keep in mind that was only 2.5 weeks ago he was here in that kind of condition, and now he's building a wall and cabinetry and space for his kids to do homeschooling while we have this whole COVID-19 issue going on. So I appreciate you coming and sharing.
Not a problem at all. I appreciate your time, Doc.
Absolutely. You mind if we share some pictures of the treatment?
Absolutely.
So stay tuned. We're going to show pictures of dry needling and some of the exercises that he was doing. So thanks for watching. We'll have more episodes on other conditions.
Appreciate it.